Welcome to the Inflation Reduction Act edition of Medicare in Minutes, a micro-learning series designed to help you understand the ins and outs of Medicare. On August 16, 2022, the Inflation Reduction Act of 2022 signed into law a bundle of provisions designed to help lower the cost of energy, healthcare, and prescription drugs. While Medicare is not the only thing being addressed, the Inflation Reduction Act, or IRA, plans to directly impact drug prices through negotiations and rebates for prescription drugs while limiting or completely abolishing practices like out-of-pocket spending caps or cost-sharing for specific benefits. Low-income subsidy programs will see expanded eligibility as well. Let's travel through the timeline of scheduled provisions and events. Starting in 2023, provisions aim to control rising drug costs through rebate programs. If the price of a drug covered by Medicare rises past the current rate of inflation, the manufacturer will be required to issue a rebate directly to Medicare. This rebate will be calculated using 2021 as a base year for determining price changes relative to inflation, and will only apply to drugs that cost $100 or more per year per individual. This could disincentivize drug manufacturers from increasing the price of prescriptions past the rate of inflation. In the short term, and for existing drugs, beneficiaries might expect prices to remain relatively stable. However, new drugs may come with higher initial price tags. Another key provision, starting in 2023, biologics, such as insulin and adult vaccines, will see a limit or complete abolishment of cost sharing. Insulin will see a cost share limit of $35 per month, no matter how many vials a beneficiary requires. This, of course, represents a huge potential savings for insulin-dependent beneficiaries. 2024 will bring additional changes. First, a 6% annual limit will be imposed on Part D premium growth. This is planned to carry through to 2030. An elimination of the 5% coinsurance for Part D catastrophic coverage is also planned. We'll spend more time on that later. Check out the Part D edition of Medicare in Minutes for more information on the current state of catastrophic coverage. Finally, the income bracket for low-income subsidies, or LIS, will be widened in 2024. Currently, depending on the household income and assets, a beneficiary may qualify for either partial or full low-income subsidy benefits. Beginning in 2024, all beneficiaries with incomes up to 150% of the federal poverty level relative to their household size may be eligible for full LIS benefits. 2025 will see a simple yet powerful change, a $2,000 out-of-pocket max for Part D prescription drug plans. Currently, beneficiaries must hit the Medicare out-of-pocket limit, work their way across the coverage gap, and reach the catastrophic phase, only to still have to pay 5% of their drug costs. More information about the current state can be found in our Part D video. 2025 will see a true out-of-pocket maximum of $2,000 for each of all Part D beneficiaries. This will result in significant cost savings for many, especially those who are treating serious conditions. Starting in 2026 and wrapping up in 2029, the Secretary of Health and Human Services will be empowered to negotiate the price of high-cost Part D drugs that do not have generic alternatives. 10 drugs will enter the negotiation process in 2026, with the list topping 45 drugs in 2029. Part B drugs will be added to the mix starting in 2028. While this is designed to lower the cost of these drugs overall, beneficiaries may not see the price reduction for some time, as a particular drug might not be negotiated right away. Lastly, drug prices will be further regulated through delay of the drug rebate rule to 2032. This rule, passed separately before the IRA, allows drug companies to create reward systems for federal drug programs doing business with them. This puts more control of drug prices into the hand of CMS instead of the manufacturers. With the Inflation Reduction Act, Beneficiaries should see some more cost predictability within the next decade, and possibly even some relief to the cost of Part D prescription drugs. While keeping up to date with all of the changes associated with Medicare can be a nerve-wracking experience, you can take steps to prevent some of the stress associated with Medicare when working with a knowledgeable agent. Questions regarding this and all other Medicare topics can be directed to your agent. Thank you for watching.